The GlycoMark test for type 1 and type 2 diabetes is the only test that is a specific indicator of recent hyperglycemic excursions. Why is this important? Because A1C can only provide long-term averages over 2 to 3 months. It will miss hyperglycemia or glucose spikes that greatly impact the patient. Understanding a patient's glycemic control history can impact how they are treated.
People can have an A1C of 7 and be running very high after meals and then crashing during the night or during the day, and huge blood sugar fluctuations. That's not captured by the hemoglobin A1C. The hemoglobin A1C is reflecting the integrated area under the curve of the blood sugar curve over a 2 to 3 month period. GlycoMark is looking at a 1 to 2 week period.
With the GlycoMark, because it's a 2-week test as opposed to a 3-month test, we have much more current data, number one. Number two, it doesn't have the same limitations that a fructosamine has.
The A1C is not the end-all, be-all in looking at the overall glycemic control of the patient. And so the GlycoMark really offered an ability to look more closely at postprandial glucose, look more closely at more quick or rapid shifts in glucose within that time frame.
An A1C of 7%, you might say, they're doing reasonably well. But if their GlycoMark is low, that indicates that that A1C of 7 is being achieved by having big spikes after meals and then lows later on. So we have to look in more detail about their therapy and what's really taking place.
GlycoMark helps me further evaluate not only glycemic control, but also using it as a short-term marker for certain patients to help me evaluate sometimes postprandial hyperglycemia and also glycemic variability, all of which GlycoMark can help me maybe further evaluate those tests and understand patients better.
GlycoMark is a specific indicator of hyperglycemia and glycemic variability within 1 to 2 weeks. It identifies glucose spikes missed by A1C or glucose measurements, detects recent deterioration in glycemic control faster than A1C.
Having GlycoMark as part of the standard of care allows you to provide more comprehensive care. It lets you decide whether you need more postprandial agents or whether you need more fasting agents, etc. It helps you dissect out what the A1C is actually telling you.
I order it all the time, along with my hemoglobin A1Cs, to be sure that they're not peaking too high or staying too high too long.
I always look at hemoglobin A1C and GlycoMark as a team. You're not going to order a GlycoMark and not order an A1C. For me, I'm not going to order a GlycoMark and an A1C without an insulin level. So I mean, it depends on your level of complexity and what you want to know. But for me, they come as a set, right? Each tell me different things. The A1C tells me a nice general overview. The GlycoMark tells me postprandial. Insulin level tells me how hard the pancreas is working. And so all of them are components of the overall surveillance.
For thorough diabetes clinicians who demand more data and information for their patients' care, GlycoMark is an important complement to A1C and all glucose measurements. GlycoMark, it's what you don't know.